As it currently stands, South Africa represents the epicenter of the HIV epidemic worldwide.
The main aim of Africa is to build a new generation of digital diagnostic tests for HIV. Our hope is these tests will work in decentralised settings and support people self-testing for HIV and linking them to care much more quickly than we currently can.
So we are using small particles that can act as artificial enzymes. They're called nanozymes, and they can enable us to have this very, very sensitive detection of the disease biomarkers. Within Africa, which is one of our really exciting projects, what we've been doing is actually sending our researchers out to South Africa. They've been working really closely with our collaborators there and starting to test our tests within the field. We hope that these tests will be easy to use, very reliable, and able to be used within the field and really make a difference in the way that people can be diagnosed and then, of course, treated. These tests have been designed specifically so that they can be read on a mobile phone.
Africa is the starting point of our rollout of self-testing, so-called point-of-care testing for HIV, which is central to reducing and finally eliminating the epidemic. We're identifying ways in which the actual tests themselves can be read, can be interpreted without any errors. That's clearly an important component. But secondly, and just as importantly, we're working with the community to understand what it is that will help to motivate individuals to take these tests and be able to test themselves. These two things are a prerequisite to actually then rolling out these tests as a regional and a national and an international policy.
We conducted two different series of studies to begin with. Some were population-based surveys. In the Africa Health Research Institute, we have a demographic surveillance platform in which annually we go to every household and ask questions from the households. And we integrated into that surveillance platform questions around mobile phone usage, just to understand what people's ownership of mobile phones were, what networks they used, and actually what they use it for. Do they just use it for texting or for phoning, or do they actually use it for some kind of things like finance or health? We then also conducted some qualitative studies where we did focus group discussions and in-depth interviews with both young people and service users to try and understand their experiences of mobile phone usage and how they saw the kind of mobile phone connected diagnostic fitting into their lifestyles and the clinical settings that they worked in.
I'm involved in the development of an app designed to assist self-testing for HIV in the context of KwaZulu-Natal. I'm also particularly involved in building a model which automatically reads the results of an HIV test based on the picture taken by the person using the app. And this is directly linked to building a large library of images of HIV tests. The app development is linked to building the image library because we are using machine learning to train our model, which means that we need a lot of different images of HIV tests for the model to be accurate. And as eventually the model will be used in the field, the pictures that we use to train the model have to be representative of field conditions, which is why we're asking our field workers to help us by collecting images of HIV tests as part of their daily routine.
Sibanika nethuba lokuhlola sihlole igciwane lesandulela ngculaza kanye nengculaza uqobo lwayo sisebenzisa ama-tablets.
I think the app will work quite well when it comes to the youth, because most of the youth are very interested in terms of using phones, and youth don't like to talk to old people and going to nurses. I think when you think of the hospital, you always think that you're sick, but when it comes to an app, you can actually navigate and have questions and get information at the own comfort of your home, at your own time and own space. And I think that would be really good for the youth.
So the formative work suggested that a mobile phone-enabled diagnostic test that links to care is something that young people would like and healthcare providers are interested in. However, in order to really know whether that works, we need to see how it works in practice. So what we are doing is testing a simulated pathway from a test through to the application reading a test, through to the young person linking to care, to see what the actual experience of this kind of pathway is.
Africa brings together an outstanding team of scientists, engineers, clinicians and public health researchers from UCL, from Imperial and the Africa Health Research Institute. And collectively, we're working together to improve and even transform HIV patient management, care and disease prevention in the global epicentre of the HIV epidemic. So I'm immensely proud of Africa. It's one of the most exciting forward-looking projects I've ever had the pleasure to work on in my career. And I look forward to the next stages of what's to come.